I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders, and it's Wednesday night. So typically on Wednesday night, we talk about a specific challenge that may arise in your life, or maybe you know someone. But tonight we're going to just talk about the products that we have here. And we're going to talk about CBD, how it works, and really what sets Wakana products apart from other products that you may see in the marketplace. So what is CBD? Well, CBD is an abbreviation for cannabidiol. And cannabidiol is, can you guys see my screen? Can someone put in the chat? Okay, good. I wanted to make sure that you can see my screen. So cannabidiol is one of the constituents or compounds that the cannabis plant makes. So when we look at cannabis, yes, CBD can come from marijuana. That's a part of the plant that gives you the high, or it can come from hemp. And that's a part of the plant that does not give you a high. And the reason it doesn't give you a high because it has a very small amount of THC or delta-9 THC. So CBD that we're going to focus on for the rest of the night is the CBD or cannabidiol that is sourced from the hemp plant. That is the part of the cannabis plant that by definition contains less than 0.3% of THC. So let's look at the benefits of CBD, because there's a lot of benefits of CBD. Lots of folks are using CBD for various reasons. It is truly mainstream. In fact, more people are now turning to CBD that comes from hemp because they don't want to be high. They want to be able to work. They want to be able to take care of their children. They want to be able to function without having a high, so they're looking for CBD. So let's look here, because there's many, many benefits. One benefit is that CBD is antibacterial. And this is why we're seeing so many CBD products that are not only being used in shampoo, but also products that are being used as facial serums, reducing inflammation, reducing bacterial infection in the scalp, on the skin, to reduce acne, reduce folliculitis, and to reduce a lot of psoriasis and dermatitis in the scalp and the skin. Another big benefit of CBD is that it inhibits cancer cell growth. So it can reduce the tumor size, it can reduce the tumor cells in number. And so we're seeing a lot of research with cancer doctors, oncologists, that are not only utilizing CBD for that reason, but also because it reduces nausea, it reduces vomiting. See, when people are getting chemotherapy and even radiation treatment, they want to reduce those symptoms. So CBD can be very helpful in doing that. CBD is also neuroprotective. So you can see that's number 3 here. And neuroprotective means that any nerve or neuron that is damaged, nerves can be damaged because of trauma, a car accident, a fall. Nerves can be damaged because of conditions like diabetes. Nerves can be damaged because of conditions like stroke. So there's autoimmune conditions where nerves can be damaged, like multiple sclerosis. So all of these conditions where nerves can be damaged, CBD can come in and be protective and help to rebuild the nerve. It can be protective in reducing inflammation on the nerve. We also see that in people who have glaucoma. They have damage of the optic nerve in the eye. So CBD can be very, very beneficial. Let's look at this next one, promotes bone growth. CBD is a product that can be used for someone who has had a fracture. They've had a fall, they've had a fracture. It can help to stimulate new bone growth. It also reduces seizures and convulsions. And that is a really big, big arena because there is a CBD medication called Epidolax, which is the only FDA-approved CBD product that's used in seizures in children. So when Dr. Sanjay Gupta came out and really talked about the fact that cannabis is a very viable option for people to use to have a holistic way of addressing their health, it was because of a little girl who had seizures who utilized at the time cannabis. It also reduces blood sugar levels. So those who have diabetes, they have elevated blood sugar, CBD can not only reduce the inflammation, but it can reduce the inflammation in very specific cells of the pancreas called the beta cells. Once you reduce that inflammation in those specific cells that regulate and modulate your sugar levels, CBD can improve those as well. It also reduces the function in the immune system. So reducing the function in the immune system means that it balances the immune system that may be hyperactive in lupus and autoimmune conditions like multiple sclerosis, rheumatoid arthritis, all of those immune functions that are really overreacting can be put back in balance with CBD. CBD also, we talked about, reduces inflammation. We talked about that already. It can reduce the risk of arterial blockage. And it's the same premise when we speak about blood sugar levels. CBD can reduce the inflammation in blood vessels in major organs like the heart that can build up plaque and can cause coronary artery disease. So CBD is very beneficial in reducing arterial blockage. It reduces small intestinal contractions. Those who have ulcerative colitis, Crohn's disease, irritable bowel syndrome. It reduces the inflammatory process that's going on in those people as well. It also reduces nausea and vomiting. We talked about that. That's why so many oncologists, cancer doctors are utilizing CBD to be an option for their patients who are undergoing chemotherapy, radiation, and may not be able to tolerate any food because they're nauseated and they're vomiting. CBD reduces pain. That's the #1 reason people are really utilizing CBD. Pain and anxiety, the top reason. So CBD helps to, and we'll talk about these pain receptors in the brain and the central nervous system. It helps to modulate the pain pathways to reduce pain. CBD slows bacterial growth. We talked about it being an antibacterial, so it can slow bacterial growth that's going on the skin, in the scalp, as well as in the bloodstream. It helps to suppress muscle spasms. So those who have multiple sclerosis, restless leg syndrome, it helps to be calming. It's tranquilizing. It's really a sedating. It helps to treat, we talked about psoriasis, dermatitis, eczema, acne, all of those skin disorders. CBD helps to reduce inflammation and bring the body back in balance. And then this is why CBD is so very effective in blood pressure. People who have high blood pressure or hypertension, CBD helps to improve the blood flow. It helps the vessels to dilate, to relax, so that the tension in the blood vessels, it's not high, and we see so many folks who have improved blood pressure. So there's other cannabinoids, there's other compounds that the cannabis plant makes. It's not just CBD, but there is delta-8 THC that we'll talk about a little bit more. There's delta-9 THC, there's delta-9 THCA, CBC, CBN, CBG, CBDV, THCV, but the main cannabinoid is CBD. But all of these other cannabinoids work in the body. They work to put the body in balance or homeostasis. They work to reduce nausea and vomiting. They work to reduce inflammation. They work to improve those who have autoimmune disease. So when we put them all together, and we're going to talk about our full spectrum product, our power products, when you put them all together, the synergy is amazing. The synergy really brings balance to the body, and you can see some significant reduction in symptoms. So this is a slide that really shows you how CBD works in the body. See, there's a science behind how it works. See, CBD is not a magical potion. It's not a snake oil. It's not something that Dr. Rita concocted in her kitchen. There is science behind how CBD works. And why this is important that you understand, because when you understand this science, then you start to think about how many people you can help, how many people you can really impact to improve their health. So the science is the human endocannabinoid system. This system was discovered in the early 1990s, and this system has a makeup of not only receptors throughout the entire body, but when you consume CBD and when they bind to these major receptors, they send signals to different areas of the body to improve. So when you consume CBD, for example, and you have issues, like I said, with high blood sugars. We look at the pancreas, right? The pancreas modulates and regulates your blood sugar because it has these cells in it called beta cells that regulate the release of insulin. So if you have cells in your pancreas that's not releasing insulin, then your blood sugar is going to be sky high. When your blood sugar is sky high and you're deemed a diabetic, what does your doctor give you? Well, they give you medication like insulin to bring your blood sugar down. Well, the human endocannabinoid system has receptors in the pancreas. So when you consume CBD, it can help to reduce inflammation in those cells. It can help to improve blood flow in those cells. And in turn, with binding to these receptors, there are pathways that help to reduce those insulin or improving insulin release in the beta cells of the pancreas. Let's look at another example. Let's look at, this is a really good example of the female reproductive tract. Let's look at the uterus. So the uterus also has receptors so that when a woman has a hard time conceiving, when a woman has a hard time maintaining a pregnancy, meaning she has miscarriages after miscarriages after miscarriage, the receptors that are in the uterus are looking for cannabis, CBD, these cannabinoids, to bind to make sure that the environment of the uterus is stable, that the environment of the uterus is able and capable to maintain a pregnancy. So hopefully you can get the gist that these are major organs and glands in the body: the heart, the lungs, the liver, the pancreas, the stomach, the uterus, the testicles, the gallbladder, the spleen, the thyroid, the thymus. All of these major organs and glands in our body have receptors. Main receptors are CB1 and CB2, that when we consume cannabis and cannabis products, our body is able to send signals. Our body is able to be put back in balance. Our body is able to reduce the inflammation and to be able to really cause some significant healing. So we talked about the fact that the number one reason people are really wanting and discovering that CBD is an option is really for their pain, right? Millions of people are in pain. And so this is just an example that we're going to look at, is that even though there's different types of pain, there's somatic pain. Again, that's that type of pain. If I just like socked you in the arm right now, that's the somatic pain that you would feel. There's visceral pain. That's the pain that's really caused by sensory nerve endings around like your intestinal tract, that causes pain in the stomach. And then there's neuropathic pain that we talked about when those nerves are damaged, like neuropathy or sciatica that you may have. Just know that the endocannabinoid system is able to modulate, regulate, and improve all of those type of pains because there are additional pathways. Not only are there receptors that we talked about like CB1 and CB2, but there are hundreds of pathways now that have been identified to improve all of these different concerns that you may have. Concerns from spasms of the legs, of the muscles, from, we talked about diabetes, to stimulating the bone, to just having a good analgesic. So instead of using Tylenol or Motrin or Aleve, there is a specific TRPV1 pathway that is really concerned about reducing pain. So CBD is legal. It's legal under the 2018 Farm Bill. So this was an agricultural bill that removed hemp from being a Schedule I drug. So for decades, hemp was classified along with marijuana, LSD, and all of those other drugs as a very dangerous drug, a drug that has safety issues, a drug that has a high potential for addiction, was removed. So the 2018 Farm Bill legalizes CBD that is sourced from the hemp species in all 50 states. So there's lots of different ways that you can consume CBD. You can use capsules, you can use gummies, you can use tinctures, you can use water solubles, you can use vape pens, you can use pre-rolls, you can use topicals. So all of these different methods of consuming CBD have a different bioavailability. They have different levels in which they are able to reach the bloodstream and have an impact in delivery and response in your body. So this is really why we always talk about using different methods of consuming CBD to address your concern. You know, if you have issues with inflammation, if you have a bad rotator cuff, you know, let's not just concentrate on using the topical, but let's concentrate on using an edible and a tincture and a topical. Why? Well, the reason why is because there's different absorption rates. There are different rates in which the body is able to utilize it depending on the method that you use. So let's look at tinctures. Tinctures take about 15 to 20 minutes. So when you put CBD under the tongue, it may take upwards to 15 to 20 minutes. Now the bioavailability is between 13 and 35%, meaning that that is the amount that's getting to the bloodstream to help you with your issue. Now the duration when you use a tincture takes about it lasts for up to 6 hours, okay? So not only is the bioavailability going to be different than if you inhaled CBD, the bioavailability is higher. That means it's going to get to the bloodstream more efficiently, but the onset of action really is between 1 to 5 minutes. It's faster, but look at the duration. The duration drops off to 2 to 3 hours. So as your tincture is still working, yes, the inhalation, that vape pen, that pre-roll worked quicker, but it didn't last as long. So again, this is the reasoning of why you want to use more than one product, because as one is taking action, the other one is wearing off, okay? So topicals, they have probably the lowest bioavailability. It's still there, but because it's giving you local relief, its onset of action is pretty immediate, and it will last up to about 6 hours. So as you put that topical on, and you have already done your tincture, and maybe you want to hit, maybe your inflammation or pain is at a 10, and you really want to bring it down quickly, you may use 1 to 3 pulls on that vape pen or pre-roll. Now you can see everything's working together. As one kicks in, the other one is working to kick in. As one wears off, the other one's still working. So hopefully you can understand this a lot better. Now, how about gummies? Well, gummies take about an upwards from 30 to 2 hours to get into the bloodstream. So that's why you want to use a gummy way before you want to see an effect, right? That's why I love using gummies at night. You know, taking a gummy 30 to 60 minutes before you're going to go to sleep is good. The bioavailability is about 13 to 19%. So it's got that moderate bioavailability to get into the bloodstream and be effective. Its onset of action is longer because why? When you eat a gummy, it's got to go through the stomach, it's got to go through the liver before it gets to the bloodstream. But the upswing on gummies is that it can last up to 8 hours. So it's a long lasting product. So let's talk about our products. What kind of products are pretty amazing? Not only are they effective, but they're safe. They are tested, they are organic. Our products are sourced from Oregon and Colorado. This FDA disclaimer is important, right? Because we can't make claims. We can't say that if you use our gummies or our tinctures or our vape cartridges, that your diabetes will be cured, right? We can't make any of those claims. So the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information for from a healthcare professional. So talk to your doctor, loop your doctor in, engage your doctor, let your doctor know that you've got this great information that you've learned about CBD, and this could absolutely be another tool in the arsenal to use, not in lieu of, but to use in addition to address your symptoms and your conditions. Please consult with your healthcare professional about potential interactions. We're going to talk about drug-drug interactions this evening or possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires this notice. So quality is really huge, right? Not all CBD is made equally. You could go theoretically right now to a gas station and buy some CBD, but try asking that person behind the counter where it comes from, how it was made, how it was extracted. Can you tell me how to use it? Can you tell me about the bioavailability? Good luck with that. So quality, quality, quality. is super important, because when you're using a product that is of low or substandard, subpar quality, and you're giving it to your grandma or your grandfather or your mom or your daughter or your sister or your husband, and they have an immunocompromised condition, they may have cancer, they may be HIV positive, they may have an autoimmune condition, they may have something that is causing their immune system not to be as strong and robust as yours and mine. Well, if that product is not a high quality product like we have here at Wakana, then that product could conceivably, potentially, theoretically, probably make them very sick. Our products are extracted from a very clean method. It's called a supercritical CO2 extraction method. It's probably one of the more expensive ways of getting the oil out of the biomass or the plant, but it is the reason why our products are high quality products. We partnered with Green Scientific. They do all of our testing. I'm here with the team. It is one of the largest ISO testing labs in Florida. It is a comprehensive testing center. Not only do they test CBD from hemp, but they do test marijuana as well. They have state-of-the-art equipment. They have chromatography, HPLC. You can see me here where I'm working with the technician, and we are doing a potency on one of our products. Every single room has a specialty. So one room tests the potency, another room is testing pesticides, one room is testing heavy metals, one room is testing residual solvent. So our product theoretically, actually, not theoretically, actually goes through every step of the testing. So our certificates of analysis are available in our products. We have a one-pager that gives you the information that you're looking for. You're looking for potency. You're looking for the fact that we've passed all of the testing for heavy metals, pesticides, residual solvents, mycoplasms, all of those very, very crucial things to ensure that you have a safe and effective product. So our products are by industry. And what is really exciting about that is that you can really share these products with anyone that can be looking for different reasons of using CBD. You may have a friend or family member that wants to lose weight. Well, we have products for weight loss. You may have a family member that really wants to address their scalp, their hair is thinning, their hair is falling out. We have a line, a hair care line for that. You may have someone that has a teen or a millennial that has issues with their skin. They have a lot of acne, they have a lot of breakout. Well, we have skincare products that address that. You may have someone that is looking for overall general wellness. Overall general wellness. We have a whole line of different CBD products. You may have someone that is really concerned about this global pandemic, the fact that this virus is just mutating and all these variants. We have a whole wellness and immune line. So we have products for everyone. Let's look at our tinctures. Our tinctures are products that, like I said, you place underneath the tongue. You start with 3 drops twice a day. We have a power line. That is a line that has that full spectrum. Remember, we talked about at the very beginning how the cannabis plant has different cannabinoids, not just CBD, but CBG and CBN and Delta-8 THC and Delta-9 THC. Where our power products is that full spectrum line that is legal under the farm. The legal limit of, it has the legal limit of THC. I'm getting a, my computer wants to pick up my AirPods, but I don't have AirPods on. My AirPods are here. Can everyone still hear me? Let me make sure everyone can hear me. Put it in the chat that you can still hear me. Perfect. You can still hear me. Wonderful. Not sure why my computer is saying that. So our full spectrum tinctures are our power line. So anything with a black label is our power line. If someone has random drug screens at their job, you want to recommend our pure line and not the power line. Our pure line is that broad spectrum product that contains less than 0.0% or less of THC. They will be able to pass their drug screen if they use our pure line. I recommend you start with 3 drops twice a day. That's a great starting dose. We also have a water-soluble product, which you can put in your tea, your smoothie, or your any food or liquid that you're eating or drinking. We also have a Hempranium or Hemp MD. It's our more therapeutic, higher grade CBD tincture for those who have more concerns on a higher level. That's a product that you would want to use. It has 900 milligrams of CBD versus 500 milligrams in the power products and 300 in the pure line. Again, you use tinctures, you put it underneath the tongue. You want to hold it underneath the tongue for 60 seconds before you swallow so that that CBD can be absorbed. We talked about the bioavailability. So the longer you hold it underneath the tongue, the more bioavailable it is to the body. So recommended dosing, even from the Mayo Clinic, again emphasizes that chronic pain, long-term chronic pain. You don't need a lot of CBD. Now, some people do, but on average, 2.5 to 20 milligrams of CBD with or without THC under the tongue is all you need. And that really does compute to 3 drops twice a day. That'll put you between 10 and 12 milligrams of CBD a day. We talk about our edibles. Our edibles are our gummies. We have gummies that are full spectrum, our power. We have gummies that are broad spectrum, that are pure. We're going to talk about later on our weight loss program, but we also have a product that you can bake and cook with. It is in a tincture form. You can put 3 drops in that favorite recipe to make those cookies or brownies, and voila, you're getting the same benefit of CBD. Now, one of our newest cannabinoids called Delta 8 THC, we have Delta 8 gummies and we have Delta 8 vape cartridges, but Delta 8 is a very close cousin to Delta 9, so it's going to give you that. Irita, do you have a question? Irita is raising her hand. Do you have a question, Irita? You can put it right there in the chat. Irita, if you have a question, you keep raising your hand. I can see the little hand thing being raised. Nope, maybe Irita, that was a mistake. So Delta 8 is a new kid on the block. It's very common and relaxing. So if you have any customer, maybe yourself, you're not getting the results that you want with the plain CBD, then utilize THC with the Delta 8. It is a close cousin to Delta 9, so you want to ask someone if they are sensitive to Delta 9. Maybe they've used marijuana in the past and didn't have a good experience. Delta 8 may not be for that person. Delta 8 really does help with creativity. It enhances sex. It supports sleep. It's slightly energizing for some. Millennials love Delta 8. Our topicals give and offer local relief. Remember, topicals work pretty quickly. Topicals, our #1 seller is our Extreme Power Pain Cream. Week after week, month after month, year after year, that is the #1 seller. So you want to utilize that Power Extreme Pain Cream for anyone that has issues, joints, muscles. Dr. Rita's Rub is another great topical product. It's in a liquid ball, roller ball that you can use very easily. This is that facial serum that I spoke about. It's people that may have issues with eczema, acne, psoriasis. Facial serum with CBD reduces inflammation, reduces the bacterial overload, and we have a body cream. Our Power Mango Body Cream, again, putting moisture back in the skin, but really addressing those issues with the skin. Our smokables work really, really fast. That's what I love about my vape cartridge. We have our Power and our Delta 8. So if you have anyone that has random drug screens, they will not be able to use the smokables. They will not be able to pass that drug screen. So these smokables also come in a pre-roll as well as our premium flour. Our Culinary line, our spices, our vegan butter, again, our Culinary Plus, you can bake and cook with these amazing CBD products. Our weight loss area includes our flat belly gummies, our flat belly brew, our flat belly bitters. Now, all these products can be utilized if you have random drug screens. These two are broad spectrum CBD products, and the flat belly bitter does not have CBD in it. It's comprised of organic herbs that help detoxify, cleanses the colon, cleanses the liver. I love this coffee. Oh my gosh. One scoop gives you 5 milligrams of CBD. If you don't drink coffee, you can add it in your smoothie, but it really does help to curb the cravings. Too many C words, right? It curbs the cravings for sugars, for carbs. It gives you energy. It helps to turn that white fat into brown fat, the fat that can help increase that metabolism and really be successful. We've got so many people losing weight on our weight loss and management program. Our hair care system, again, utilizes CBD to address alopecia, hair thinning, hair loss. We're seeing so many people losing their hair because of so many reasons: stress, diet, COVID, you name it. Our sexual health products address libido, reduction in maybe vaginal lubrication. Our CB Lube can bring back moisture to the vagina. Our KOJ gummies can help bring that stamina back, that libido back. Amazing products. Now, the essential oils are all organic. I love the peppermint. I use the peppermint for natural energy. I'll use it on the soles of my feet. I love the First Defense. This is a nasal spray. It utilizes CBD and essential oils. We do know the viruses and bacterial particles, they enter through the nose. So you want to use this during this time of year, flu season, global pandemic, to reduce the viral load and bacterial load. Many of you on the line may have come in as a full crown jewel dispensary owner, or many of you on the line are going to purchase this after this presentation. Again, amazing products that we talked about tonight comes in this full crown jewel dispensary. We have starter packs as well. The person who invited you will discuss with you all the prices and perks and advantages. But I just wanted to show you, again, these products that we talked about are in the stimulus package. They're in the millennial package, depending on if you want more gummies and pre-rolls, that's a millennial. If you want more tinctures and gummies, that's the stimulus. Want to just end by talking about drug-drug interactions. There is one medication called warfarin or Coumadin. It's for those who've had blood clots. So if you're on warfarin or Coumadin, you want to talk to your doctor, let your doctor know you want to use CBD. You can use CBD, but your doctor needs to monitor your INRs more closely. There's other medications that we use for asthma, theophylline. If you're on theophylline, again, your doctor is going to need to monitor your theophylline level. Doesn't mean you can't take CBD, you just need to be monitored. Drug testing. Now, I want to make sure that you understand that your employer should be using LabCorp's urine test. This is a test that's very sensitive that can tell if you're using CBD or THC, right? Those urine drug screens that you get from Walgreens or CVS, they're not very sensitive. They're not very specific to which cannabinoid they're picking up. So LabCorp has a very sensitive and specific test that will pick up CBD by its ratio. So if the ratio is over 10, that means you're using CBD products. So you're not out there wilding out using THC products. If that ratio is less than 1, that's pretty consistent with the fact that you're using marijuana. So thank you for your attention. I am going to take questions now. I saw a lot of hands being raised. I don't know if you accidentally touched your button, but if you need to reach out to me, that's my email, ritamd@wakana.com. If you're a guest on the line, you want to reach out to the person who invited you so you can get your products ordered. I'm going to take questions right now because I saw a lot of hands being raised. You can put your question in the chat, or you can put your chat question in the Q&A. There's a Q&A box or there's a chat box. Either one you can use. Any questions? Well, great. If there's no questions, then I'm going to let everyone go. It's about 9 o'clock. And if you're a guest on the line, connect with the person who invited you on this line. You can get your products ordered. We can ship them out tomorrow, and you can get started. If you are on the line and you are interested in weight loss, you want to join our Flat Belly 2.0 Facebook page. You want to get those products in your hands. Thank you. Is it Edra? Warren, thank you so much. Well, be well, be safe. We will see you back here next week, Wednesday at 8 p.m. Central Standard Time. And thank you as well, Anna, for your time and for your attention. We'll see you soon. Thank you, Monica.